What do you get when you combine simplified practice marketing, proven ROI strategy, and Van skate shoes? You get Mark Thackeray, of course. So lace up, grab your green smoothie, and get ready, because this is Dental Marketing Secrets. And this is Mark.
It is that time again, my friends. Welcome back to another episode of the Dental Marketing Secrets podcast, where, as you know, our whole goal is to provide you with tips and tactics to grow your practice so that ultimately you can serve more patients and leave a greater legacy, because that is the name of the game, my friends. My name is Mark Thackeray, and I'm just excited to be here. You know, there's a ton of things going on in the world right now. We're in January, first week of January 2021, a lot of stuff happening. And really and I look out the window and it's just a beautiful day here in Salt Lake City. I'm looking up at the Wasatch Mountains. And despite everything that's going on in the United States, all across the world, let's take a step back and appreciate that we've got an opportunity to do something good today. You know, and that's what's so cool about each day is we have that chance to make a difference, to make a positive impact. And we're in a unique position in the healthcare industry. We get a chance to do that on a regular basis. Very, very cool. Today, I wanted to talk about your practice and specifically on hygiene. Okay. This is a topic that I've really been so eager to talk about this. And I'm just pumped that we have really the best speaker out there for this. I have Rachel Wall joining me on the show today. A lot of you know who Rachel is. She is the coach. She's a coach. She owns Inspired Hygiene, where they help develop hygienists so that they become more engaged on the team. They're better team players, and improves the overall experience and dramatically increases the bottom line too. They're just phenomenal at what they do. And Rachel has a whole wealth of experience. She's got 30 years of experience as a hygienist, a profitability coach. So she sees both sides, really. She's got the clinical perspective and experience as well as the business experience. And that's what makes her such a good fit for this episode. I'm so excited to have her on the show. She actually has written a book too. A lot of you have heard of this. It's called Return on Hygiene. And we mentioned this at the very end of the podcast, but it's renowned. I mean, it's now become essentially the hygiene benchmark Bible that a lot of practices use across North America. So she knows what she's talking about. That's what I'm trying to say here. And we have a great conversation about hygiene and different aspects of hygiene, how to really uncover the untapped portion of hygiene to help you grow your practice. And she's got so much practical advice. You're going to want to listen to this probably a couple of times. Make sure you have a pen and paper handy. A lot of really practical application or really practical action steps that you can take. So without further ado, here is our interview with Rachel Wall. All right. Welcome, Rachel, to the show. So excited to have you on here. Thanks for coming on.
Absolutely. Thank you, Mark, for inviting me. My pleasure.
You bet. You bet. So hygiene is a topic that I've been wanting to address for a long time now. And I'm just going to jump right in because I think you could speak to this better than anyone. But if because I know you've been in both positions, right? You have a lot of experience, both clinically and also, as a coach now and on the business side of things. So what would you say, Rachel, to a practice or to dentists across the country about hygiene? What are they missing? Or what are some things that you wish every dentist knew about hygiene?
Yeah, great question. So this year is 30 years. We just rolled over to 2021.
Yeah.
I can't believe that, everybody makes the joke. Yeah, I was 8 when I started. No, I wasn't 8 when I started, but yeah, it's been 30 years clinical. And I've been really fortunate to work in some offices with dentists with different personality styles, different clinical styles, that kind of thing. But all, I would say, for the most part, very willing to, share their knowledge with me. So I would say I wish dentists knew the true impact that they have the potential to make on a hygienist and his or her entire career, their personal life, all of those different things. They really do have the potential to make a huge positive impact on our career. And I had the opportunity to experience that early on. I worked in a practice that was very old school, starting out in a small town. And even in that situation where we didn't know anything about the business part of the practice, we just, kind of came in and did our job, and we had a good team environment, and then we left. But even in that, I learned a lot from those dentists. And then I moved into more of a modern type of practice in a university town. And that's where really things opened up for me. And so I would say I just wish dentists knew that their mentoring, their coaching, their sharing of their clinical philosophy and knowledge with their hygienists can really set them up in a really strong way with a foundation to not only, grow their career, but also help grow the practice.
Yeah, absolutely. And like you said, there's so many different ways to do this. And there's not necessarily one right way, that's exclusive to everything else, but there's a lot of things that factor into this, as you're thinking about that, Rachel, and you mentioned something. You mentioned just recognizing the impact that you have on your hygienist career, so and even the clinical philosophy. So give me some examples of that on what you've seen that you feel like are great examples that dentists and practices could draw from.
Yeah, so I think one example is the dentists themselves being willing to change and adjust their clinical techniques, right? So always being willing to learn new ways of doing things, and also being willing to admit, like, hey, this is what I knew, and I did the best I could with the information I had, and now I have new information, so we're going to change things up a bit. We're going to change, how we deal with certain clinical situations that come in, because now we have more resources. I remember, working with a dentist that I worked with here for years in Charlotte, Dr. Chris Bowman. I remember a specific example when I had teed up treatment for this patient on a molar. There was decay that was moving towards the furcation area. We talked about a crown and buildup and crown lengthening, all of this. And he comes in, he's like, I actually think that the better long-term solution would be an implant. And so that was a little different than what we had been treatment planning before. Yeah. And so I had a good relationship with him. So I went to him and I said, can we talk a little bit about this? Obviously something's changed in your mind, and I need to know that so I can support you and the patients in this co-diagnosis. So I think that's a good example. And he said, look, I've just been taking a lot of CE. I've been looking at these teeth and all of the time and money that these patients are investing. And I really think there's a better long-term prognosis with an implant. So now all of a sudden we had a new standard in this situation. So he was not afraid to shift, right, with new technology and new understanding of things that we have to work with. Right. And then he was willing to educate the clinical team, the assistants and hygienists, and the business team too, honestly, on those new philosophies. So I think that's one example, is the dentist being setting an example as being willing to continually improve our skills, because sometimes hygienists say, well, that's not the way I learned it in school. Well, right. Man, I hope I'm not practicing exactly the way that I was 30 years ago in 1991. So we've got to be willing to grow and change and not feel like what we did in the past is wrong. It's just that things evolve, and we want to stay on the forefront of that. I would say another example is challenging, right? Challenging the hygienist to think outside the box and to see them as a true colleague with the dentist, and also to see your whole dental team as healthcare providers and being willing to step into that role. And it's hard, we see sometimes, for hygienists who want to do that, right? They want to have these more in-depth oral systemic link conversations with their patients. They want to bring in some of these adjuncts to periotherapy or diagnostic adjuncts, chairside testing and things like that. But the dentist isn't on board or isn't ready to go in that direction. And so it holds the hygienist back. So I would say, just listen, like, where do they see things going? And can the dentist get on board with that and support the hygienist in learning and growing in that area? Yeah,
so it sounds like there's the flexibility needs to go both ways, where you're open to receiving feedback and you're coming together to determine, okay, this is why we're doing it this way, and we're both in agreement for that. And it's all for the betterment of the patient and the outcomes, right?
It is. And by the way, too, we get tired of doing the same thing over and over and over again. If you talked to the same podcast guest every day, you would get bored and they would get bored of talking to you, right? So that there's a lot, let's say it's easy to fall into that trap. We call it the prophy trap in hygiene, to just kind of doing the same thing over and over. It's easy to fall into that. So when we're looking for ways to expand our care, it makes it more interesting for everybody. And the patient gets better, more comprehensive care.
Yeah, absolutely. Now, so for a hygienist or even for a dentist who isn't as comfortable with that kind of setting where you're having to come up and say, this is the way we're going to do it, or we're going to change things. What are some recommendations that you have, Rachel, for someone to approach that situation that might not be comfortable doing that?
I'd say start small. So maybe just look at one thing, so if you're, let's say you want to completely revamp, the perio program, which is one thing that we work a lot with our clients on, is, maybe if you feel like there's some resistance there, first just talk with the hygienist and say, okay, what are maybe some of your frustrations on a day-to-day basis with your clinical work? And, maybe they'll say something like, gosh, I'm having a hard time staying on time, or my patients just aren't doing their home care and they're bleeding, and, I have to manage that. And then say, what if there was a way that we could all work together to figure out a way to maybe better communicate to patients what is health versus disease. Right. And then just hearing them out and maybe tying some of their frustrations back to, maybe it's not all the patient, right? Maybe it is, we have an opportunity to expand our conversation and our understanding of what is health and what is disease. So I would say if someone's not comfortable, because I don't know any clinicians that are comfortable with just doing a 180 on their clinical philosophy in one day, right? It takes time. So just start to step into it. And, maybe it's like with a dentist, I'm just trying to use kind of those things that dentists would understand. It's like, you're not necessarily going to jump in and the first case you're going to do placing implants is all four. You might place some really straightforward implants first and get really comfortable with that. So, the same thing with hygiene is maybe don't start with, hey, we're going from, not doing a lot of diagnosis of perio and doing a lot of difficult prophies to, non-surgical therapy with lasers and local antibiotics tomorrow. Just start with, let's diagnose this. Yeah. Let's start opening our eyes to what's there. And then there's just going to be a natural progression to, okay, I'm seeing that these patients have disease. Now, what do we do about it? And then the door is open. Yeah. Yeah. I love that. It does start with that initial conversation, however small it is, but just the chance to express yourself and really better understand where the other person's coming from, and you have to be willing to have those conversations. And I think, if you're having those, especially making time for those on a regular basis, they're more likely to come up and it's going to be a lot easier for both sides. So now, okay. Yeah. So, go ahead. Well, we teach a simple process called case review, and it really is designed especially to help the dentist transfer their clinical philosophy and knowledge to the rest of the team. But it can go the other way, and it be focused on hygiene procedures as well. But, just bringing cases to the table and the dentist just say, okay, this is how the patient presented. And, here are situations where I would do a crown instead of a filling, or here are situations where I feel like I can be a little more conservative and use photos, like the intraoral photos are priceless. Mm-hmm. And so, the dentist being willing to kind of put their philosophy out there to be questioned, right? Right. It kind of breaks down some barriers and questioned in the spirit of learning and getting calibrated, right? Not questioned in the way of not trusting, but if the dentist is willing to do that, it's just going to kind of bring down some barriers and just make everybody more comfortable. It's just a collaboration effort is really all it is. Yeah. Yeah. I love that. Okay. So now, put on your business hat for a sec, because I know you're really good at translating, all this training that you do with hygienists into profit for the practice, really affecting that bottom line. So talk to us a little bit about that and how hygiene contributes to the overall success and profitability of a practice. Yeah. So, the obvious is the production contribution, right? How the procedures that they're performing. And And the more expanded the hygiene procedures can be, typically the more productive the hygiene department is, right? Because they're not just depending on prophies all day.
Right.
The only way to increase production in a prophy focused practice is just more patients. And then what we find is then if we're shortening time and just trying to get more patients in the schedule, it will increase hygiene production just because of the volume of patients that are coming through. But what tends to happen is the diagnostics fall away. So then you're not capturing those higher level procedures in hygiene like periotherapy and things like that. And also it takes away from time the hygienists have to pre-diagnose and to pre-enroll doctor treatment. So, that's really one of the biggest contributions that hygiene can make. So yes, there is a production contribution, but they can also have a huge impact on, the doctor's production by preheating the patient, by pre-educating the patient on what they see. And, every practice is different. Some doctors say, hey, I want to train my hygienist, and they know that in this situation, I'm going to recommend this or this. And they let the patient know. Typically, doctor recommends these two treatments, and she'll come in and she'll let you know what she feels like is best for you. So that's a huge way. And that's something that I think is really untapped in many practices. And it's not that hard to open that up, right? It starts with a conversation and really letting the patient or the hygienist know, as a dentist, that you support them in doing that. And then just teaching them. So it's not that hard, and it can have, a huge result. I would say the other area that we all know that hygiene really contributes is relationship building.
Yes.
So often the patients just trust the hygienist because they spend so much time with them, and they develop those relationships and they get to know each other. And so they really can build those relationships. And healthy dental patients are healthier overall patients, and patients with healthier, better overall health live longer. So they get to be patients in your practice longer. So
Absolutely.
There's just a lot of ways that hygiene can contribute to the overall success of the practice. Asking for referrals, and, just having patients refer back to the practice because of hygiene is big.
Yeah. And that's something I've noticed a lot too, is those that really do focus on that experience that occurs in a cleaning, for example, with a hygienist, and that relationship building feature that you just mentioned to that aspect of that whole process. They're the ones who do end up, they diagnose better, and they, are more treatment and more effectively, and they generate so many more referrals, because that's really, where you're spending the bulk of the time, and they're the ones who have the rapport, those that are taking the time to taking advantage of the time they have with the patient in the chair, and that's something, like you said, that I think is maybe undervalued, because, and I've seen this happen too, where practices will, a hygienist will move on, and a lot of those patients go right with the hygienist because they have that relationship,
Yeah. That's interesting that you say that. And it's tough on a practice when that happens, right? So I think that, we don't ever want a dentist to be held hostage, right, by a hygienist and feel like, oh my gosh, I've got to deal with maybe a difficult employee because of this. So we don't ever want that situation. I think there can be a healthy balance there between that. And certainly, dentists, they're like, well, I want to have a relationship with my patients too, and they should value my treatment. So 100%, right? This should be a doubled effort, right?
Yes.
By the hygienist and the dentist in building those relationships. But that is interesting. And I think that brings up another piece of, a piece to talk about with regards to the business is, how do you acknowledge and make your team feel appreciated and want to stay right in the practice? And then also, how do you protect yourself as a practice owner from a exodus of patients if a hygienist leaves? Because the hygienist has spent a lot of time investing in those relationships, and the practice owner has spent a lot of time getting those patients into the practice too. Right.
Right. Yeah.
Whether that's marketing, right? They've spent a lot of time and money investing in that, bringing those patients into the practice through marketing, through their own CE and the treatment that they can provide. So, there are even some practices that are, having almost like a non-solicit type of agreement with hygienists is if you choose to leave, I mean, certainly that's, everybody's free to choose and move where they feel like they're best to, be employed.
Right.
You can't solicit patients to follow you. And, there are ways that people find ways around that kind of thing, but that's interesting. And that is something that I'm seeing more and more. And it's, kind of a touchy situation or a touchy subject, but I think it's something that's worth at least considering.
Yeah. Yeah. And it really goes back to what you talked about earlier too, Rachel. And that's just having those open, candid discussions with the dentist, and making sure that they're on the same page, that everyone's, feeling engaged, feeling like they're contributing, feeling like they're all pulling in the same direction, because then, it makes it so much more enjoyable to come to work when you are, you're part of a team, you're part of something bigger. You have the same goals in mind. Yeah. And so it has a traumatic effect, I think, too, just on the overall numbers of a practice, and then from a business standpoint, I mean, it's 7 to 10 times more expensive to generate a new patient than to get one to come back.
Keep one. Mm-hmm.
Yeah, I know. And because you've invested, and you pointed this out too, you invested so much, not only time and effort, but money, and resources to get that person to even come through the door, which is one of the hardest things. And then it's really, then it comes down to relationships after that a lot of times. And so, so that's a big deal for sure. So one question I had too, that when you were talking came up, and this is partially because I've had clients in the past that were similar to this, where they didn't really have an established hygiene program. They were more of, hey, we're going to do kind of churn and burn a little bit. I don't love to use that phrase, but that's kind of how it was, where they would, it's more volume play. So for someone like that, what would you say to them to maybe help them kind of catch the vision of what hygiene can do for them in their practice, and how that might change, even their day-to-day, schedules and things like that.
Mm-hmm. Yeah. And I think that, at least the clients that we've had the opportunity to work with that have been in that position, they want to make a change. They want to have a more thorough hygiene experience, right, for their patients. They want their hygienists to have time to educate, to make these connections, to enroll the appropriate care. But, it's like anything else. You get on a speeding train, it's really hard to get off.
Yeah.
And usually there's some incident that happens, or maybe they meet with someone, trusted advisor like you or their CPA or somebody that says, hey, you've got to kind of take a hold of this because this is a runaway train, and it's going so fast, but it's not getting your practice anywhere. Yeah. It's just like you said, it's just this cycle that patients are moving in and out, but they're not, either hygiene is flatlined with production, or the dentist is working so hard to keep up with all the exams, and it's become a burden. Right. And so no longer do they think of exams as an opportunity to connect with the patient, opportunity to diagnose treatment. It's become like, oh my gosh, I've got to do another hygiene exam. So those are some reasons, right, when dentists start to say, okay, I've got to look at this a little bit differently. And so what I would say is the first thing is to understand that in order to get ahead, whether that is to add services to hygiene, increase hygiene production with a more quality versus quantity way, you sometimes have to slow down a little bit in order to get to that next level.
Right.
So you have to reserve time in the schedule for high-level treatment like periotherapy. You might need to give hygiene more time with each patient so that they can do the diagnosis for doctor treatment and for hygiene treatment. So very often you have to slow down in order to get ahead. And I will say we've never had a client that has slowed the hygiene schedule down, meaning they've added more time to the appointments, when they didn't also increase production if they followed our advice. Now, if you increase hygiene time, but you don't do anything else, your production is going to go down.
Right.
And you might be okay with that. I mean, there's some dentists that are like, I'm okay with that because I can't keep up with all these hygiene visits, and either I don't want to have a partner or an associate, or I just can't find somebody right now, whatever that might be. So some are okay with that. But if you put in place these diagnostic skills and treatment presentation skills and those kinds of things, then, and you give hygiene the time to do that, it will ultimately increase the productivity and profitability of the practice.
Yeah, and I think you touched on that earlier too, where you said, that's the risk that a lot of practices run when they're so focused on new patient generation, where those prophies, they go so fast, and they don't give the hygienist time to really diagnose and go do a thorough job. Is that what you were talking about before?
Mm-hmm. Yeah.
Yeah. And that makes a lot of sense. Yeah. Sometimes we just get so busy. Like you said, the speeding train analogy is a great one. It's just hard to you can't do much to slow that down. And it's just it's easier really to keep on that, even though, it might not be going in the right direction. So yeah, a question for you now, Rachel, is what, now let's transition a little bit to more of the patient perspective. How important is that hygiene experience from a patient perspective in your eyes?
Well, it's extremely important. I think it goes back to what we were saying about, creating raving fans and people that we're going to refer. So, there's a business expert. His name's Dan Sullivan. He started a company called Strategic Coach.
Yeah, I just read one of his books. He's awesome.
Yeah. So he uses this term referability. Are we referable? And I'm gonna try to remember these. I think there were 4. One is saying please and thank you. One is finishing what we start. One is doing what we say we're going to do. And then the last one is being on time. So, if we're never on time and patients constantly have to wait, then that immediately reduces our chances dramatically that they're going to refer their friends and family. And it's hard. I mean, especially right now. I went in, and I've been in hygiene several days. I've been in clinical several days since COVID started. And, it's hard to stay on time before. It's hard to stay on time now.
Yes.
Between fogging the room between patients and, just screening, taking temperatures and different things that we have to do. It's difficult. So if we can stay on time right there, we're stacking the deck in our favor.
Yeah.
So that's a patient experience, is how on time are we? Do we get back to them if we say, hey, I'm going to call this specialist for you? Are we getting back to them? Are we helping our dentist, do what he or she needs to do to move all that forward? And, then just the simple thing of thanking our patients for coming in and being part of our practice.
Right.
Super simple,
Mm-hmm.
But it makes a big difference. So yeah, the patient experience is big. And I think that it's so easy for us to lose sight of that because we're just scurrying around the office every day. So it's good to get in the chair yourself and, see what it's like. Is it cold in there? Is there a ton of dust, on the x-ray unit that's,
right.
patients are looking at? I mean, it's good to just do that once a quarter. I try to do that as a hygienist. I try to get in and be a clinical hygienist. So I see what our clients and our customers are going through every day.
Yes.
And it's hard to do that. So, I know that takes time, but, get in the chair and see what it's like to have that experience.
You mentioned the on time factor, and just how, I think that's a fantastic point in the patient experience. It is a hard one to nail down. There's so many moving pieces to that, but I think if you're following some of the recommendations that you mentioned previously, which are to look at increasing your hygiene time, allotting a little bit of extra time there, even as a buffer to make sure that that's coming in and that you have adequate time to do everything you need to do without rushing or anything like that. But imagine how powerful that is, from a marketing standpoint, being able to tell everyone, hey, we're going to see you within 10 minutes, but from when you arrive. Like that is just, how many practices do that? Very few, but if you could do that, how that would be so effective. And the other thing is going back to the patient experience. And again, staying on the same, it seems to be the recurring theme, but staying on the same page as providers, it's nothing's more disheartening to me as a patient when I'm in the chair and I see a hygienist and the dentist, and you can tell there's tension there, or they just don't communicate at all. And I feel like, oh, I'm having to repeat the same story. I've said it 3 times already in this 20 minutes, and first to the person at the front desk and now to the hygienist and now to the doctor.
Yeah.
And it's like, is anyone even listening?
Yeah. So what we teach is the hygienist gathers that information, right? So if there's a situation that the patient's concerned about, or if the hygienist has discovered a problem, right? A tooth problem, a gum disease problem, whatever it might be, that the hygienist communicates that to the dentist. Now, that doesn't mean that the patient can't jump in and add something if they want to, but they communicate that to the dentist in the handoff. And what we suggest is, instead of the hygienist meeting the dentist in the hall and talking about it then, that they do it in front of the patient. So then that way, you hear the hygienist communicating your concern to the dentist and you think, yeah, that's it. That's exactly it. And then the dentist says, okay, I got it. So then you feel like you've been heard, and you know that the dentist knows, because if they tell it in the hall and then they come in, sometimes the dentist might say, hey, I understand you have, a sensitive tooth or whatever it might be, but it saves time. So, it saves time. So the hygienist they don't have to have that separate conference, before coming into the patient. And if they can do that also in front of the patient, so that the hygienist and the dentist they're all like in this little triangle of trust, it's been called, that they're all having a conversation together, where the hygienist says, Dr. Mark said this lower right tooth is sensitive. This is the tooth that you did a crown on, a couple months ago, and it's gotten better, but it's just still not right. So I went ahead and I got out the articulating paper. I have a handpiece. I have everything ready in case you feel like it needs to be adjusted, but I know he would really appreciate you taking a close look at that. Yeah. So now all of a sudden, it's going to get the attention it needs. I've prepared. So the dentist doesn't have to say, yeah, I need to adjust this. Where's the articulating paper? And then the hygienist has to either go through the drawers or go down the hall or whatever and get that. And that's really listening. The hygienist asking the patient, what changes have you had since you were here last?
Right.
So open-ended question. And really listening, and then knowing what the next step is going to be, right? Preparing for that. Yeah. And I think that most hygienists do that. I think, though, that a lot of dentists feel like, yes, however, I think it could go the next step, right? So the hygienist might say, number 14 is sensitive. Can you check that tooth? But giving the dentist that information that, I did a crown on that a month ago or 6 months ago. Right. Because it was 6 months ago. I might not remember. I mean, a lot happened in 2020, right?
Yeah. Oh, yeah.
I mean, so 6 months ago was like, 3 years ago in 2020 years.
I know.
So just giving them that insight of what happened, so I've looked back. I'm like, okay, we did that crown. And I noticed in the clinical notes, it said that the decay was really deep. So just giving them that information is so helpful, and it will just help that doctor exam be shorter, because that's one of the things we hear too, is the hygienists feel like, I'm waiting, I'm running behind because I'm waiting for the doctor exam,
right? Or
the doctor exam is taking too long. So then both parties have to take responsibility in that, right? What can I as the hygienist do to help minimize the waiting? How can I help the dentist know that when he or she comes in, I'm going to have everything ready, so it's going to be efficient, rather than, because if the dentist knows I'm going to have to dig through this and figure out what's going on with the patient and start from scratch, then they're not going to leave the visit. They're not going to leave the patient there with. They're going to finish that up, and then they're going to come in. And so it's going to be we could talk about that, for another 30 minutes, but there are things that we as hygienists can do to tighten that up and to make that process more efficient. Absolutely.
And as a patient too, I mean, it's helpful to hear, to hear those potential problems a couple of times. I mean, I wish we could say
Right.
that we were perfect at our retention of what we hear the first time, but that's just,
No.
that's just not the case, and so
No.
hearing
And
that a
people are
couple of times,
nervous and
yeah. Yeah. And there's
Yeah.
distractions, and some might be on their phone, off their phone, and so if you're hearing that in sometimes in multiple ways too, yeah, then it's going to sink in. And I love how you said, having those details and the background and the context reaffirmed for both the doctor and again for the patient. I mean, just understanding that.
That's right.
Yeah, you've had a crown, and that was really sensitive. That went really far. It was deep, and so just helping to remind them that, oh, okay, that's what it could be, and it's just legitimizes everything that you're saying.
Exactly. So that's a really good point. It reminds the patient too, and they might think, oh yeah, that's right. I do remember that they told me that the decay was really deep. So, I think that's a really good point too.
Yeah. And there's one last thing too. Well, I've got two last questions for you, Rachel, and then we'll wrap this up. But so one is, if I'm a practice, so there's, as you know, more better than anyone, everything that goes on in your standard, cleaning, your standing pro feed, everything that gets checked, for the patient, that I feel like a lot of times that goes undervalued. A lot of patients don't really recognize the depth of analysis that goes on whenever they come and get their teeth cleaned. I mean, you're checking things that have direct implications of their overall health and things like that. Any comments on how, or ideas or suggestions on how a practice might be able to better articulate that or message that to their patients? Because I feel like that's a missed opportunity for a lot of practices.
Yeah, I agree with you. And I always say our patients don't know how well we take care of them unless we tell them. Yes. So they don't know when we're pulling their tongue out what we're doing, that we're looking for oral cancer. So it's really as simple as just as we're doing that, saying, what I'm doing is I'm actually screening for oral cancer and looking for any unusual lumps or bumps, and if you ever notice anything, please don't hesitate to give us a call.
Yes.
And, if there's a sore in your mouth that doesn't go away within a week or two, please come in, call us, come in, and we will check it. So I think it's just, sometimes, hygienists and dentists, there's a lot going on. They get overwhelmed. Like, how can I have a whole nother conversation about this or that? Just have it as you're doing it. Right. Have it as you're doing it. So you're taking the patient's blood pressure, right? And as you're taking the blood pressure, saying, most of our patients see us more often than they see their physician. So we just feel like it's really important to be another place of screening for blood pressure. It's something that's really underdiagnosed, and it can be a risk for heart attack and strokes. That's why we do this. And, things like that, oral cancer, as we're talking to our patients about their medical history, if you see something on there, if they say, I have arthritis, ask a little bit more about that and say, you know what, we're going to do a really thorough exam of your gums, because we know if you have gum infection, it can make the arthritis, you can have flare-ups and maybe make that worse. You had a heart attack. Well, we're going to make sure that we really look closely to see if you have any active inflammation in your gums or anywhere else, because that can increase your risk for another heart attack. So just always be thinking every little clue, everything you see, like try not to tune out. Right. And it's tough because we do this over and over and over in the course of the day, but just try to have every patient have fresh eyes on it. And even if you don't pick up everything, even if you don't tell them about the blood pressure and tell them about the oral cancer and tell them about if you pick one thing and you say, I'm going to focus on this and get really sharp with this for the next 2 weeks, then it's going to become a habit. And then you can add on the next thing,
Right.
So just, we can't do it all, but if we can just always kind of have that critical thinking piece turned on in our mind and just be looking at like, how is all this connected? Because patients don't know. They just don't know why we're asking them the questions that we are, or why we're taking their blood pressure, and they just don't know. And if ever it was important to, focus on our patients' overall health, it's even more important now. And I mean, there are practices now that are going to have the opportunity to be involved in vaccination and all of those things. And I'll just say, I've been thinking about this a lot, and I haven't shared this anywhere yet, but I've seen some dentists comment in some groups and things like, hey, we need to just stay in our lane. But, that might have been what the sleep doctor said when dentists started, treating sleep apnea with oral appliances.
Right.
And that's probably what the endodontist said when general dentists started doing, limited ortho.
Yep.
So if we want to be recognized as healthcare providers, we've got to be willing to step into that. And not everybody's going to be comfortable providing vaccines. And that is a personal choice, for every practice owner and provider. But I think it's an opportunity. And I think it's an opportunity to just raise the bar on how patients see our industry and how our industry contributes to consumers' overall health. I really do.
Yeah. And just touching back on the patient experience of that, if you're in the chair and they're showing you, hey, this, and explaining everything that they're doing to help you as a patient, it's all in terms of direct benefit for the patient.
Yeah.
Then how could you not feel so much better about what you did? About dedicating, an hour and a half every 6 months to come in and get yourself checked and cleaned and all that
Right.
stuff. And a lot of those people actually are going to go and take those little tidbits and be like, hey, guess what I learned at my dentist today? You wouldn't believe, what they were checking me for.
That's right.
And it's cool. There's education leads to empowerment, and when your patients feel empowered, they're much more likely to trust you and stay with you as a patient in the long run. So I think that's a great point to make. Okay. So last question would be and this is just kind of a general one, but anything that based on your experience working with practices, any common mistakes that you see that when it comes to hygiene, anything that you feel like, oh, I just wish I could go in there and share them with this little thing here or there, and it would dramatically improve this or that experience with hygiene?
Yeah, I would say just, again, just having clear standards in place. That I think that would be it, is having a common standard of care so that everybody on the team knows, this is our interval for when we're going to do a perio, diagnostics. This is when we're going to do a perio screening. And when we see this, we're going to recommend treatment, right? This is the threshold from health to disease. This is what we believe in our office. And the dentist really upholding those standards and holding the team accountable, and the team holding each other accountable to that. So I would say that might be one, is just not having a clear outline and a clear written list of our clinical standards. And that can be everything from when do we take blood pressure, when do we do perio charting, when do we move a patient from a prophy into perio to, when do we take x-rays, what are the risk factors we use to determine when we take x-rays,
right? What
do we do when we see a suspicious lesion on the soft tissue? Like, what's our process? So just really working through that and everybody being on the same page with that. And it takes more time than you think because a lot of discussion comes up, sure. But it really helps everybody be on the same page. So there's continuity of care and patients are getting the same level of care no matter which hygienist they're seeing.
Yeah, I love that. That's perfect. And how much easier that is for a new team member to come in on board and just like, oh, this is the process. Here's all the details. You have that blueprint, right. That game plan that you can refer back to. Makes it so much easier.
Yeah.
Awesome. Thank you so much, Rachel, for taking the time today.
Yeah, my pleasure.
Last thing is, so if people are want to learn more about Inspired Hygiene, if they want to connect with you, what is the best way to do that?
Yeah, two ways. So one is we have a book that I'd love to share with everybody. It's called Return on Hygiene. And the website is rohbook.com. And everyone listening can get $10 off the book. So you're pretty much getting it at our cost. We'll ship it to you. And the code for that is DMS Podcast, all caps. So DMS Podcast is the promo code for the book. So check that out. That'll give you a lot of a review of what we talked about today, and also a little bit more in depth on our philosophies and things that we teach. And then you can reach out to me at Rachel, Rachel, Rachel at Inspired Hygiene, and would be happy to, set up time to chat with anybody about how we might be able to help the practice, or, just hear about some of your challenges in hygiene, or we love to hear good stuff too. So find me on social media too, and tell me what's happening that's really great in your practice, and brag on your hygienist a little bit.
Absolutely. We need more of that going around. That's for sure.
Yeah.
Well, there she is. Thank you, Rachel, again for doing that. I'll make sure I'll post all those, all that up in the show notes so that we have the rohbook.com. You get $10 off on the Return on Hygiene book that Rachel wrote. And make sure you check out Inspired Hygiene, and feel free to reach out to Rachel, like she mentioned. But thank you so much, Rachel. Appreciate you taking the time today.
Thanks, Mark. My pleasure.
Did you enjoy this episode of the Dental Marketing Secrets Podcast? Head on over to iTunes to subscribe, rate, and leave a review. And for more proven marketing strategies to grow your practice, visit practicerocket.net.